Thank you so much for joining us on this beautiful episode of our health discussion. I know it's been a while, but today we have a beautiful discussion about your fertility. How do you know you're fertile? What makes it for you to know that you are fertile? What are those things, those parameters you're going to use to say, oh, come on, everything is all right? If you're clicking on our channel for the very first time, you're all welcome. This is Women's Health Forum, where we discuss health issues related to women and reproductive health in general. If this is your first time, please don't forget to hit that red subscribe button and subscribe. Please keep us a comment. If you have a question, do it to keep in the chat below. If you have something to add, please do it to add in the discussion. Thank you so much. So we are going to look at those fertility aspects that will make you know that you're fertile or not. So the very first point we're going to talk about is your menstruation. Your menstruation. Menstruation here, you're going to look at the color. We're going to look at the length of time that you menstruate. We're also going to look at how is the texture of the menstruation. So the color, if the color is dark throughout, then you could have issues with your fertility. It's good that you get to your doctor. If your menstruation color is red, that is absolutely beautiful. If the texture of your menstruation is, let's say, it contains clot in it, please, it is also good that you get to your doctor because that might affect your fertility. Another thing we need to know about menstruation is that normally menstruation is the beginning of something in the sense that when you see menstruation, it means a whole lot is good. But seeing it is not enough. You need to look at all these other aspects. The next thing is ovulation. Ovulation. Ovulation is the time that an egg is actually released from your ovaries into the fallopian tube. Without ovulation, it makes it very difficult for you to get pregnant. It is actually medically impossible to get pregnant naturally without ovulation. So, your ovulation should tell you that you're actually fertile. Now, what are those things? We have symptoms of ovulation. There is headache, there is pain by the side, there is the egg white cervical mucus, there is breast tenderness, there is increase in the basal body temperature, there is heightened sense of smell. Some ladies even complain that they actually have maybe an increase in the way they eat. Some say that they don't even eat at all. So, but if you don't have any of these symptoms, no urge for intercourse, no heightened sense of smell, no pain by the side, no increase in basal body temperature, no headache, no breast tenderness, no egg white cervical mucus, please get to your doctor. You might have an issue with your fertility. The next is your menstrual cycle. If your menstrual cycle is below 21 days or more than 35 days, get to your doctor. If your menstrual cycle also comes, let me say, in between another, let's say you menstruate on the first of a month and by the 15th of that month you menstruated again, get to your doctor. You might have an issue with your menstruation. If you, with your fertility, if your cycle as a whole, let me say you are a 21-day cycle and then suddenly it changes to 35, then please get to your doctor because that will be irregular cycle and this can affect your fertility. It might mean that you have an issue with your fertility. The next vital issue when it comes to you knowing that you're fertile or not is your vital reproductive organs. Here we are talking about the ovaries, the womb, that's the uterus, the fallopian tube. All of these are all things that will tell you if there is an issue with your fertility or not. So you need to do a pelvic ultrasound to see if there is an issue or not. The next are your hormones. Check your hormones. If any of your hormones has an issue, you might have hormone imbalance in which either the hormones are lower or they're higher than they should be, then get to your doctor because you might have issues with your fertility. The next are the STIs, sexually transmitted infections. You need to check all of this. If you have an issue with the STIs, then it might mean that you are having issues with your fertility. STIs are many, but take note: chlamydia, mycoplasma, syphilis, gonorrhea. Those four major STIs, please take note. These are major STIs that can have a vital issue with your fertility. Excuse me. The next is your lifestyle. Now, with lifestyle, most people don't pay attention to lifestyle, but it's a very, very important aspect. So, what you eat can affect your fertility. So, if you say you're fertile, please, you might check your lifestyle. Maybe you're a smoker. That smoking might cause you to have serious fertility problem. Okay, maybe you drink a lot of alcohol. You can have serious fertility problem because of that. The next thing is exercise. A lot of ladies don't do exercise, and exercise can affect your fertility. Please start doing it. The next is water. Many ladies don't drink water, and you don't even think that water can have an impact on your fertility. We all need water so that our system can be hydrated. If you don't take enough water, please, it can affect other major organs. So do well to take your water. The next thing is your weight. Is your weight okay? Your good weight is the weight that has a BMI, body mass index, between 18.9 right up to 24.9. Let's just say between maybe 25 right up to between 19 right up to 25. So if your BMI falls between 19 right up to 25, then we consider it to have a good weight. How do you know if your BMI falls between this? What you need to do is you take your weight, you divide by your height times height. So you're going to take your height times height. Let me say my height is 2 meters. 2 times 2 gives me 4. If my height is 3 meters, 3 times 3. So you take height square, height times height. So if your height is 3 meters, 3 times 3. If your height is 2 meters, 2 times 2. If your height is 1.5 meter, 1.5 times 1.5. Keep that answer. Then you take your weight and you divide by that height. Once you get that, then we now see that that answer is what we call the BMI. If that answer is more than 25 and above, then you're overweight. Right up to 30 and above, then you are obese. But if it's below 24.9 or below 24, then we consider it to be underweight. So please work on your weight and work on all of these other factors we've made mention of. Remember, we mentioned menstruation. Remember, we mentioned ovulation. We mentioned the menstrual cycle, vital reproductive organs, hormones, STIs, lifestyle, exercise, water, and weight. Remember, there are still some that we've not mentioned of, so we've not mentioned it. So you're watching, you can even put some in the chat below. It will be welcome. So all of these will make you to know if you are fertile or not. Being fertile does not only mean that you are actually releasing an egg. You might release an egg, but there are other aspects of your fertility which are not balanced. I wish every lady the very best. If you're trying to get pregnant, may the good Lord make it much more easier for you to conceive. Please do not forget to follow us here on YouTube. We are Women's Forum. We are also Women's Forum on Facebook. We are also Women's Forum on Instagram as well as Twitter, now X. May the good Lord be with you. Please keep us your questions. And if you need a follow up for those who are within Cameroon, please use my WhatsApp number in the first comment of this video. May the good Lord be with you. Thank you. To have a beautiful time.